We're here with Dr. Jenna today to talk about COVID. It's the fall, and as we're seeing an increase in cases across the globe, we thought this would be a perfect time to get some additional tips and strategies on how to ride the storm for the rest of the year. Dr. Jenna, thank you for joining us. It's great to see you.
Thanks for having me again.
Let's talk a little bit about what's going on with COVID right now. We're seeing a pretty significant increase in cases across the U.S. and lots of parts of the globe as well. Along with that, a lot of restrictions. What can you tell us about what's going on?
Yeah, so as of today, we are seeing a lot of stay-at-home measures being put into place across Northern European countries, Western, Central, and even parts of Eastern Europe. It's not entirely unexpected. We do know that this virus is a respiratory virus, and so we expect it to spread easily in the colder, drier months, similar to viruses such as influenza. But unfortunately, we are seeing those upticks. Countries such as Germany, France, the Czech Republic, where we have you have your site and turn off, seeing some pretty high numbers of both illnesses and hospitalizations. North America, I think we're lagging behind by a few weeks, but we are definitely starting to see higher numbers here as well, particularly in Colorado, along with hospitalizations. And so with that, we are just seeing different regions respond with various forms of stay-at-home measures. Fortunately, mortality we are seeing is lower than it was in the spring months when the pandemic was first declared. I think that's a bit of a combination of younger people who are getting sick and then some of the treatment measures in place. So for example, steroid treatment with dexamethasone, convalescent plasma, remdesivir has some positive effect in reducing duration of symptoms. And so with these measures and a little bit of improved knowledge on the doctor's side about how to support patients with low oxygen, we are seeing that translate to lower mortality, but unfortunately we're also seeing the spikes.
Yeah, thank you. Thank you for sharing that. I know we've talked about a vaccine in the past, but what is the medical opinion about progress towards a vaccine? And certainly once one comes out, what do you think the deployment process would look like?
Yeah, that's a great question. I think it's on and it should be on most people's minds. We've seen unprecedented progress towards a vaccine across the globe. It's been just a really impressive coordinated effort. Here in the United States, Operation Warp Speed, which is sort of a public-private partnership between the government and various pharmaceutical companies and universities, they've invested majorly in 3 candidates. One is the Moderna vaccine, one is the AstraZeneca vaccine with the University of Oxford, and one is the Pfizer-BioNTech vaccine. All 3 of those are in phase 3 clinical trials, which are the large clinical trials geared towards assessing the safety of these drugs, these vaccines. We already have some good data showing that they are safe in smaller group sizes. I'm hoping, and I think a lot of people in the medical community are hoping to see some interim results of these trials in mid-December. But realistically, I think bringing the vaccines up to scale for the entire population is going to take quite a bit of effort. And so we might not see wide-scale use of a vaccine after the safety is proven. We might not see that until next summer or fall. If we do have a vaccine candidate that's proven to be both safe and effective, we'll probably see it deployed towards target populations such as immunocompromised patients, elderly patients, and other groups at risk, healthcare workers.
Sure, that makes sense. Thank you for sharing that. One of the things that we've been talking a lot about here at CourseTech is the protocols. We feel that early on, certainly at the onset of COVID, we took a pretty strong leadership position to make sure that we put in the right protocols and guidelines in place to keep our employees safe. And quite frankly, I'm extremely proud at all of our team members, the way they've responded, really adherence to those protocols and doing the best we can to keep each other safe.
Absolutely.
With the increase in cases that we just talked about, unfortunately, we're not immune to those increases either, and we're starting to see uptick in cases in many of our facilities across the globe. So having said that, along with the protocols and continued diligence, what advice do you have for us to ride this storm, particularly as we get into the cold season?
Yeah, I just want to start by saying I completely agree. I think that CourseTech adapted some of these protocols very early before we had really a strong amount of data to necessarily support them, but based on the understanding that your employees, we wanted to keep your employees safe and keep their families safe. And so I agree the adoption of these measures was really impressive. What we are seeing in general is that when cases do come into the facilities, it's because of smaller household gatherings, social events outside of work, recent travel. Fortunately, we don't see a ton of spread within the facilities, so I think that is just more evidence that the protocols are working and how important it is to continue those protocols even though we are feeling all a bit collectively sick of COVID-19. I do think the employees here seem to be doing a fantastic job of being self-aware and self-reporting symptoms. So I think the first thing is just to encourage employees to keep up that really good behavior. One thing I do want to just address is sort of boiling down or simplifying what works, what we think works. We don't have a vaccine, we don't have a proven preventive or therapeutic treatment yet. So I like to describe it as sort of a Swiss cheese model. It starts with physical distancing, and we think that 6 feet at least really helps bring down the chances of transmission by droplets or aerosols. Beyond 6 feet, there's still an advantage, but you get a bit of diminishing marginal returns on that. But that's important, obviously. And then adding masks, which, Coors Tech adopted back in April, May. We know it's an imperfect intervention, and we admit, in the health world, we admit that masks are not going to be perfect all by themselves, but it's sort of an additive effect. You look at distancing, you look at masks, and you look at hand hygiene. And if you use all 3 of those appropriately, it really significantly reduces your risk. And so we know that not one of them is the perfect answer by itself, but using all 3 together and continuing to do that is important.
Good. Great advice. Thank you. I read a post the other day that really resonated with me. It was something like, if you don't prioritize your wellness, you'll be forced to deal with an illness. And that struck a chord with me because there is quite a bit of COVID fatigue happening. I know I'm personally feeling it. We're certainly feeling it at work and in our family lives. And I think as a result of that, we're experiencing unprecedented stress levels to go along with it. Along with COVID fatigue, with parents having to deal with online learning for their kids, social unrest still happening across the globe, just to name a few big items that we're having to deal with lately. What advice would you give us to cope with those stress levels and to get our mental and health wellness back in check?
Oh, that's such an important question. I think just to sort of start with, talking about just how common it is and just putting a name to it, which you've done here, is really important. So, we saw in a recent CDC survey in the United States that 40% of U.S. adults are suffering from varying degrees of anxiety, depression, and substance use related to this pandemic. So you are certainly not alone if you are feeling stress about it. And that number rises even higher for essential infrastructure workers, up to 50 to 60%. I think it's just acknowledging just how common it is to have these feelings right now is really important. And then I think discussing, reframing what stress is to us, because I think there's a stigma against stress and anxiety, particularly in these science-minded fields, science and engineering, where we're dealing with a more qualitative topic and qualitative diseases. But the fact is that there is a genetic basis to anxiety, depression, and even substance use. And when you add to that certain childhood experiences that just make you more susceptible to suffering from them, I think that acknowledging that is helpful for patients to wrap their minds around it, and it hopefully would decrease the stigma associated with reaching out for it. So then when you ask about, what are some strategies we can use to address it, I think the first thing that's really important is to reach out, whether it's to a friend, a family, your practitioner, or the chaplains here at Coors Tech, because I know that is something that's been made available. Really important to reach out and let someone know how you're feeling, particularly as we get into winter months. Unfortunately, a lot of the non-pharmacological interventions for COVID-19 involve varying levels of isolation. And when you start to feel lonely, that's when it's important to let someone know. We want to know. We don't want people to be at home trying to bottle all of this up. And so reaching out is important, and then understanding your own risk factors, your family risk factors.
Right, good. That's terrific advice. We talk a lot about the importance of caring for our employees in mind, body, and spirit here at Coors Tech, and I think this is a really good opportunity to remind all of our team members about the resources available to you. You can access them through our COVID intranet page. But just to name a few, our wellness champions, which are located at all of our facilities. As Dr. Jenna pointed out, our marketplace chaplains. Most of our healthcare plans have wellness apps that you can download on your phone to give you some strategies and tips. Additionally, most of the wellness plans also carry with them access to therapists, a lot of virtual conversations that can be happening now. But the key is to reach out, as Dr. Jenna pointed out. Certainly reach out to those resources or reach out to your HR business partner, your leaders. Have a conversation about it. Most importantly, and we're here together. We're going to get through it together. But certainly reach out if you need the support.
One other thing that I just wanted to bring up, which actually I had a really interesting discussion about this with one of the HR business partners here, was that a lot of the stress that employees might be feeling here could be a combination of both fear and a sense of lack of control. It's certainly not uncommon to have those feelings in the midst of a pandemic, but strategies to address those too. Having an understanding of what triggers you. Some people have trouble looking at the news. It's a constant 24-hour news cycle and it's stressful. So if there are things in your life that are causing you to feel triggered or stressed, it's certainly fine to limit your exposure to those to maybe once or twice a day to help cope with this stress. And it affects all of us. I mean, personally, I've found myself having problems with sleep, mind racing, and I find that getting back to basics like creating a checklist can be helpful. Making myself work out, which is not always the first thing you want to do, but you can find that the enkephalin release when you do workout can actually be quite helpful for stress reduction. So whatever works for employees and their family members, every person has their own way of dealing with it, but just acknowledging the stress and then dealing with it is the first step.
Absolutely. Good. Thank you. Well, so as we move into 2021, we know, and thank you for highlighting, obviously going into the winter season, we need to continue to be mindful. As we go into 2021, I know you don't have a crystal ball, but what could we expect relative to, continued spikes or potentially getting some relief from this middle of the year?
Yeah, well, I wish I did have a crystal ball, and I think that what we're seeing with these winter spikes, as we sort of addressed at the beginning, is that we thought this would happen because of, we at least know that SARS-CoV-2 is a respiratory virus. And so the fact that the numbers are going up, it's disheartening, but it's not completely surprising. And if I had to predict, I would guess that that is what we're going to continue to see, is that, as atmospheric conditions change, and as we have holidays when people want to see their families and friends and travels, we're going to see spikes after that. And so, my prediction is that until we have a vaccine or, more than 50 to 60% prevalence of this virus, it's going to remain a virus that we're not immune to. And so we will see spikes in response to drier, colder temperatures and in response to holidays. And that's why this question of when we'll have a vaccine becomes all the more important. And we certainly hope that we'll have one that has more than 50% efficacy. And if and when that happens, I think we will start to see that the likelihood of transmitting the virus is going to be lower over time. And so these spikes will not happen so abruptly after higher risk problems like cooling temperatures and vacation. So my hope is that perhaps next winter will not be as bad as this winter has the potential to be. And I would expect that once we get into the spring months of 2021, that our numbers will go down. And then just sort of to frame this from the perspective of the healthcare providers, when we see these numbers going up, one of our top concerns is healthcare resource utilization. On the individual level, we're learning more and more about the virus, that younger people tend to not be severely affected. That's not true for everyone, but looking at the population, we're seeing that. And so the problem for us becomes one of how can we take care of as many sick patients as we might have. And that's why we're seeing these stay-at-home measures locally and regionally, is so that hospitals and healthcare systems can deal with the increased numbers. So just reframing it in that perspective, I think, can sometimes be helpful.
Good, excellent. Thank you. Well, very, very helpful information as always. Thank you so much. Any final thoughts that you'd like to share with us?
I mean, I would like to turn it back to you, Irma, because I think that, from my perspective, the Course Tech employees have done really a fantastic job of staying resilient amidst this virus. But I am happy that that we're taking the time to address stress and some of the very real psychological effects that this is having. So,
good. Thank you. Thank you. Well, I think this is an important reminder, but most importantly, a sense of gratitude and thank you for all of you out there in the globe doing your part to not only stay safe, but to keep your fellow team members safe as well. We know this is a tough new way of working right now, but we appreciate you coming in, doing an incredible job every single day, following these protocols, continuing to do your part to ensure that you keep your fellow employees, but also your family members safe. But continue to think about how we can support you as well. Please feel free to reach out to your HR business partners, your leaders, marketplace chaplains, all of the resources that I mentioned a minute ago. Flexible work arrangements, whatever it takes. We're in this together, and together we will get through it, I have no doubt. But thank you very, very much for the work that you've done, the efforts so far, and I look forward to talking about this being gone soon, hopefully next year.
I agree.
Thank you.